Seska Therapeutics develops and markets integrated cellular therapies and medical devices that advance the practice of regenerative medicine. Today, we will walk through Seska's clinical program for critical limb ischemia at Fortis Hospital in India and hear about their recent achievements. We will also hear patients talking about their own experience with Seska's experimental treatment for CLI.
Critical limb ischemia, as the term is very clearly telling you, is ischemia of the limbs. Ischemia means reduction of the blood supply to the limbs.
The predisposing factor for CLI are hyperlipidemia, that is high cholesterol, hypertension and diabetes. Lifestyle, including smoking and usage of tobacco, is a major factor in these patients, and heredity also plays a key role.
6 surgeries were done in one day, and the vein got opened for 3 hours and again stopped working. It would start again but stop after 3 hours. This went on for 15 days. Then I went to another hospital and got 2 of my toes amputated, hoping the pain would go away after that. They left the wound open, saying they needed to see if the blood would come out, but the pain just kept getting worse. An MRI was done on my leg, and the doctor said that there was no choice but to amputate the leg. That's when Dr. Bukhari suggested cell therapy. I agreed. I found out 7 years back when I started getting a pain in my leg. After getting no relief from the surgery, the doctor told me that my leg would have to be amputated. That's when I got very worried and got referred by my doctor to see Dr. Bukhari for cell therapy.
The current treatment strategies for CLI are surgical and endovascular procedures aimed at revascularization and improving distal limb circulation. In layman terms, we currently have 2 options. 1, bypassing the blockage using a graft, and 2, by opening the artery using a stent or through a cleaning procedure meant to remove the blockage. Despite technical advances in treatment of CLI, more than 30% of patients do not qualify as a candidate for revascularization because of excessive surgical risk or adverse vascular involvement. The last available option for these patients is limb amputation. At 1 year following diagnosis of CLI, 25% of these patients will have died and 30% will have undergone amputation of a single limb.
Several early phase clinical studies have shown cell therapy to be potentially safe and effective for treating no-option CLI patients, but firm evidence remains to be collected under properly controlled pivotal trial conditions. Till date, Seska has completed 2 clinical feasibility studies which have collectively treated 30 no-option CLI patients of Rutherford 5 category. To summarize these results, at 12-month follow-up, we observed an amputation-free survival rate of 54% using intra-arterial delivery with a sample size of 13 patients. In another study, there was an amputation-free survival rate of 70% using intramuscular delivery with a sample size of 17 patients. In addition, these studies demonstrated cell production quality and intraoperative feasibility using our SurgeWorks system.
Following completion of Seska's India-based phase 1 and 2 feasibility study in 2013, I have been approached by patients in desperate need of a solution for their CLI. Having exhausted all non-surgical and surgical options, I felt compelled as a primary physician and caregiver to try and help. So I requested Seska support to use the SurgeWorks CLI and VXP system with the consent of the patients and in compliance with local regulations. This corresponded with Seska's interest in collecting point-of-care sterility data. Though this experience was not conducted as an investigational study, I have followed up with 6 recent patients to track their progress. Upon 6 months follow-up, I observed the following. The mean pain score at rest was reduced from an average of 7.6 to 0.67. 4 of the 6 patients reported no pain. At baseline, 5 of 6 patients were suffering from foot ulcers or open wounds. However, at 6 months evaluation, none of the patients presented with ulcer or gangrene or open wounds. 5 out of 6 patients were major amputation free at 6 months follow-up. So now, after seeing these positive results, we are heading for phase 3 pivotal study with large number of CLI patients who are at high risk of limb amputation. Currently, there is no other alternative option available for these patients other than limb amputation. I am very hopeful that we will be able to save their limbs because of this therapy.
In July 2015, Seska Therapeutics received approval from US Food and Drug Administration for a randomized, double-blinded, placebo-controlled, multi-center phase 3 clinical trial. The objective of this study is to evaluate the safety and effectiveness of our integrated point-of-care platform, the SurgeWorks CLI kit and VXP system for the treatment of non-reconstructible Rutherford Category 5 CLI patients. We look forward to begin our patient enrollment in this study and provide you future updates on our study progress.